Hi, my name's Alan Davies. I'm Director of Digital at the Innovation Agency, which is one of the 15 academic health science networks.
What are you most excited about in our report?
I think the report is fascinating. It's well overdue. At last, we're really beginning to try and tackle the real determinants of old age and living well, living healthily. Not just at a macro level, dealing with some of the big issues that we're dealing with today in terms of pollution and in terms of nutrition, but also at the micro level, empowering local communities to take some responsibility themselves and us as individuals to also understand more about our health and be able to do something about it and actually ensure that future generations can enjoy the benefits of long life and not the curse of it.
What sort of role will your specific organisation have in this?
So the academic health science networks are very involved. We call ourselves, or have been called, as the spread and adoption agency for the NHS around real innovation. So a lot of the stuff, and it was mentioned earlier, Matt Hancock mentioned atrial fibrillation. We were responsible for working on an NHS commission to try and raise screening using single lead ECG devices to understand the extent within the population that we have atrial fibrillation, and then to empower local communities to do something about it. And that means that what we can do, hopefully, is help people who are unaware that they have a particular disorder themselves to get involved and to do something about it so that they themselves can live longer and healthier lives.
Do you think central government is going to have to be the galvanizing body? They are going to have to really get everyone to coalesce around our ambitious goals laid out in our report?
I think central government has a critical role to play. First of all, today, in terms of bringing it to everybody's attention, showing that this is a serious issue, right up there with climate change, as we've heard earlier from many of the speakers. But also, it's a partnership. At the end of the day, for this to be successful, as we've debated in the groups that have helped to contribute to us this report, we recognise that central government can only do so much. What it has to do then is engage with local government, engage with the wider communities to actually take some responsibility of delivering on some of the objectives and some of the areas that we've touched upon today.
What sort of changes might you make to ensure that you have a healthier, longer life?
So I have a specific focus and interest around data, and we've heard today that one of the objectives is an open life data framework. What we're doing within the Liverpool area, which is the area that I'm responsible for, and we'll hear Professor Ian Buckham talking about it, is to create a local ecosystem. We've talked about in the report data that cares, but this is a situation where we want to see the local population providing their data, not just statutory data, but locally held data together, so that that data can be used to help us all to live longer and healthier lives. So what I'm going to be taking away from today is a renewed vigour in that particular area. We're working on something called a consent engine to try and understand and provide a tool that individual members of the public could use to dynamically show the level of consent that they want to give to their data being used for predictive and preventive purposes. Because we really believe that it's only by having an honest and open conversation with the public, giving use cases of how that data can help save lives and change lives, that we can really continue to grow this agenda that we've talked about today.
Isn't the largest problem, though, that data capture has been demonized in light of, Facebook, Cambridge Analytica? We need to get through that. We're not going to hurt you with this data. We just need it in order to improve your lives.
Absolutely. The data has such a bad reputation given recent events, but that's why the work that we've done with patient groups in the Northwest, but across some of the North, has indicated that if we can have an open and honest conversation, if we can actually show people what their data is going to be used for, if they have dynamic personal control of switching that on and switching it off, being able to talk it on, and an auditability, as we've heard earlier, so that what that data is being used for is reported back, then not only can we get the public's confidence, but we can keep the public's confidence over the long term for the usage of that data for their good and for their children's.
So transparency and consent. Thank you so much, Alan Davies.
Real pleasure. Thank you very much.